Good morning, Miss Lynn. I will reporting the urinary incontinence. So, definition of the urinary incontinence is also known as a involuntary urination. It's uncontrolled leakage of urine. It is common and distressing problem which may have a large impact of quality in life. It's been identified as an important issue in geriatric healthcare. So they have a causes and risk factor of urinary incontinence. So first is obesity. Excess body weight and put extra pressure on your bladder and pelvic organ for dysfunction. Second is pregnancy and childbirth. Many women have incontinence during the pregnancy as the expanding of uterus put weight on the bladder. Third is menopause. At this age of life, due to the hormonal alteration, the body can undergo different changes. So in that introduce aggravate that symptom of incontinence. So next is enlarged prostate and glands surrounding the urethra, the tube through which urine passes of the body. An enlarged prostate means the gland has grown bigger. Next is the urinary tract infection. Infection can irritate your bladder, causing you to have a huge to urinate and sometimes incontinence. Next is aging, increased age, body mass index, and parity will possibility associated with incontinence as we current smoking, type of 2 diabetes, and hysterectomy. Next is smoking cigarette is associated with an increased high risk of both urinary incontinence over active bladder. Also, constipation has two main bladder and nerve overactive and emotional and psychological factors: stress, anxiety, depression, cognitive impairment, and effect. Next is pharmaceutical drug. Some medication or neurological condition can also urinary tract incontinence. The last is the lifestyle factor. Drinking too much caffeine, alcohol, smoking, not drinking enough fluid can irritate your bladder. So these are the sign of symptom. Common sign of symptom of the urinary incontinence include the leaking urinary with coughing, sneezing, laughing, or exercising, feeling sudden, uncomfortable, urge to urinate, frequent urination, waking up many times at night, kanamo na siyang magbata-mata ka, gading dako, ihi-ihi, and urinary during sleeping, kanang matug ka, nyo kabaw nga nakaihiday ka. So this is the diagnosis of the urinary incontinence. Urinalysis, a sample of urine check for a sign of infection, trace at blood, there are abnormalities. Blood diary for several days of record how many you drink when you urinate, the amount of urinate you produce, where you can have used the urinary number sentence episode. Post void decidual measurement, you ask the urinate void into container that measure urine output. Then your doctor check the amount of your leftover urine in your bladder using a catheter or ultrasound test. The large amount of leftover urine in your bladder, you mean that you have obstruct in your urinary tract or problem with your bladder, nerves, or muscle. So there are the treatment and the medication for urinary incontinence. So treatment for urinary incontinence depend on the type of the incontinence. So severity, that the underlying cause. A combination of treatment and be needed if an underlying condition is causing your symptom. Your doctor will first treat that condition. Your doctor may recommend less invasive treatment to start with the movement through the arrow discharge technique to field help. The behavioral technique, your doctor may recommend that bladder training to delay urinary after you're getting yours to go and you're starting trying to hold after 10 minutes every time you feel that urge to urinate. The goal is to lighten time between the trips at the toilet until urinary, the only 2.5 to 3.5 hours. Fluid and diet management regain a control of your bladder. You may need it back or avoid alcohol, caffeine, acidic food, reducing liquid and consumption, losing weight, or increasing the physical activity who also can ease the problem. Female pelvic floor muscle, your doctor may recommend that you have do the exercise frequently to strengthen a muscle that help control the urination, also known as giggle exercise. This technique are especially effective stage and continence but may also help huge continence. Work out and holding contraction of 10 seconds at a time. Aim to the least the 3 set of 10 repetitions each day to help identify the contract right muscle. Your doctor may suggest that you work a pelvic floor physical and therapies to trying biofeedback techniques. So medication is commonly used to the treatment incontinence include anticholinergic. These are medication can calm. So pwede na siya pampakalma siya, and overactive bladder and may be helpful to huge incontinence. Examples include the oxybutini, tolterodine, darifenacin, physotordine, sulfasalazine, and tropichloride. Mirabone used to treat huge incontinence. This medication relax bladder muscles and muscle can increase the amount of the urine bladder can hold. It may increase the amount of your able to urinate that one time, helping empty your bladder can completely. The alpha blockers is mean but who can huge incontinence overflow the continence. There are medication relax the bladder neck muscle and the muscle fiber in the prostate and make it easier to empty the bladder. Example include the thumb solution, Flomax, Alzocin, or Orasatral. Caregiver intervention, schedule a bathroom trip or if necessary provide urinary or commode to make reach the toilet easier. Encourage a bladder training like Kegel exercise. Encourage change diet and fluid intake, and take some constipation, pressure on hard stool in the rectum and can make urinary incontinence worse. Most of intervention is to establish a normal urinary elimination, include a different independent nursing functions such as promoting adequate fluid make and maintaining a normal breathing habit and assisting with increasing the fluid, make it up to 2 liters a day. So kinahanglan jud mainom siya 2 ka liters so sa kadlaw. San high fiber diet like oat milk, siya bladder training include toilet habit and medications such as short-term cost laxative or treat constipation. AIDS has such incontinence pads.